Welcome to the Health Angle Podcast with Dr. Mike Headlee and Dr. Gordon Fimreite, where we'll be exploring different angles of health to achieve the best version of yourself. Now here's your hosts, Dr. Mike and Dr. Gordon.
Hi, I'm Dr. Mike Headlee, and with me is Dr. Gordon Fimreite. Welcome, Dr. Gordy.
Hey, Mike, and welcome everybody to the Health Angle Podcast. Today's subject is going to be on ear infections. And Dr. Mike, last week, and you had mentioned ear infections, and I thought, what a great subject. And I have a personal story that I will share about chronic ear infections as a child. So today's episode is on ear infections, also known as otitis media, also known as middle ear infection. So welcome to the Health Angle Podcast.
Yeah, Dr. Gordy, thank you for sharing with that last week. And the reason I wanted to talk about this is I've been in chiropractic over 30 years. The first 10 to 15 years, the number one reason I would see children was for ear infections, and then colic is second. Now today, I see a lot of some ear infections, but stomach, digestive, spit up, and reflux and constipation. However, I still get people coming in with their kids after they have the tubes in. So I just wanted to talk about this subject. And I can't tell people to get tubes. I can't tell people not to get tubes. I can't tell people to take an antibiotic. I can't tell people not to. But I can talk about it and the causes and simple remedies that holistic natural people use, and a little bit about chiropractic and why that is beneficial. So I think this will be a great topic to discuss.
Yeah, I agree with you, Mike. And I think if I could go back in time, the information that we will present, I wish my parents had when I was a child. It would have made a world of difference. So hopefully some of the parents will watch this and really get some good ideas on things that they can do natural. One of the things I want to just point out, and I learned this years ago, as a child who's developing, they have short eustachian tubes. And if you could just take your pinkies, and this is what they look like. They're parallel and they're short. And then as we grow as an adult, they elongate, so the head gets larger and expands. The eustachian tubes kind of go down to an angle. So the negative about parallel and short eustachian tubes is if a child drinks milk or some other product that might have a lot of mucus and they cough or sneeze, that can ultimately end up in the eustachian tube and harbor an environment for ear infections. So very common in children. So children are definitely more prone to ear infections than we as adults. However, I might point out that your childhood ear infections can echo into adulthood. So, and the other thing I want to just point out, Mike, before I throw it back to you, is chronic ear infection. What is that? Or chronic otitis media. What is that? When fluid or swelling or infection behind the eardrum does not go away and it keeps reoccurring, this now becomes a chronic condition called chronic otitis media. And I believe this is what I had, Dr. Mike. And as a result of that, my parents didn't know what to do, and they ended up having me to go in, and they had a procedure where they actually put a tube in my eardrum. The eardrum tube, what it was meant to do was allow drainage of the infection from your ear. But to this day, I have chronic ear ringing as a result of that. Now, I don't even know if I knew what ear ringing was before, and I probably had it all my life. I just didn't know. The reason I really know what it is now is I can hear that ringing, especially like if you take a flight, I can really hear it. At night, I can really hear the ear ringing. But I'm conscious to it, and I'm also used to it. So conscious meaning that I know it's there from our education, but I'm also know that it's there because I can hear it. I can literally hear it. I have to have a fan on at night to kind of keep the noise, just kind of have a white noise, so to speak, that will drown out the ringing. So that's one of the things I do now. Am I mad and angry about it? No. I just wish my parents had this information, and it's going to be very nice to put this out there so that people know that there's other solutions besides the ear tubes. And you might be thinking, well, how does ear tubes result in like ear ringing, it can cause like scar tissue on the eardrum itself. There's not a large group that actually end up with ear ringing. It is a small minority, but again, it does happen, and I'm one of those people.
Yeah, that's unfortunate. And obviously, our parents do the best that they know how for their kids. They care for us so much. They bring us in and they trust people and they do a procedure. Most of the time it works out. Yeah, that's unfortunate. I didn't remember that, or I didn't know that you ever related that story to me. So,
Well, I think it's one of those things that when you've known all your life, it's really not a big deal.
yeah.
And you don't share it because you don't really know that it's there unless you're ready to go to sleep and you might hear some ringing, but that's only if you're conscious of it. And who knows? Could there be other things in the inner ear? Possible, but I really think that it's from the eardrum and the perforation that was there. I think it's only a small group of maybe 10 to 15% based on one study that I saw.
The DC behind my name stands for Doctor of Chiropractic. However, I also think it stands for Doctor of Cause. And so I like to try, if I can, to find the cause of things. And whenever I see someone coming in my office presenting with reoccurrent ear infections, or even just one that the parent wants me to help the child with, and or they're scheduled for tubes, and they say there's just too much fluid buildup, they're worried about hearing loss and falling behind in school and speech issues. My first question is, what's causing the fluid behind there? What's causing the buildup of fluid and pressure? So that's why I want to talk a little bit about causes of ear infections, and then we can both talk about solutions and other things like that. So ear infections are basically caused by bacterial or viral pathogens. The most common culprits being Streptococcus pneumonia, Haemophilus influenza are two of the most common, and then viruses such as RSV, influenza, adenovirus are primary contributing factors. And what they do is they create blockage of the eustachian tube, which connects to our middle ear, like you said, when they're short and across, doesn't allow it to drain. And so viral respiratory infections, also the nasal passages are really tiny on little kids too. And my kids didn't want to blow their nose and clear that out when they're little. And some parents, they get bulbs to suck out mucus and different things. Allergies can be a big cause. Tobacco smoke, exposure to tobacco smoke, Dr. Gordy, can irritate the eustachian tubes and increase the likelihood of ear infections. I was surprised at this. Pacifier use. Prolonged pacifier use has been linked to an increased risk of ear infections, particularly in children under the age of 2. Daycare attendants, let's face it, it's a germ factory. It's hard. They're chewing on their own toes. They're chewing on the baby's toys next to them. They put everything in their mouth, and it's a lot of germs. And tell the kid to sneeze and cough in their elbow and use a Kleenex. Good luck with that. They do their best. Bottle feeding, lying down with a bottle can cause milk to flow into the eustachian tubes, increasing the risk of ear infections. Anatomical factors, like you said, they can just be predisposed to not draining. And so those are some major causes of ear infections, and you have to address the cause, I believe. Otherwise, my experience, Dr. Gordy, is you put tubes in or just get repeated antibiotics. That doesn't address the cause usually. If it's an allergen to, like you said, dairy or wheat are the two biggest mucus producing foods that kids eat, and you put tubes in and you're still building up all this mucus and phlegm, and the tubes get plugged up or fall out, and then you go back in. I mean, that's just a big procedure for a kid to put them under and to risk long-term ringing in the ears, etc. So any other comments about causes on your end?
Well, I was just going to say the real culprit, really, when it comes down to it, is the eustachian tube. Not the ear, but the eustachian tube. Then, like you had made mention, it can become blocked from a different pathways. One is allergies, You could have a cold as a child or even as an adult. That could be a source. Sinus pressure, that's a big one. Basically traps behind the eardrum. So it's a perfect breeding ground for infection.
Yeah, and the biggest comment I get from parents with children with ear issues and chronic and reoccurring, and they bring the kid into the doctor and they really kind of pressure them, giving them one option, ear tubes or nothing. And why are the parents concerned? Because antibiotics fight bacterial infections only. They have no effect on infections caused by viruses, right? And that's common sense to a lot of people. What are viruses? Common cold, seasonal influenza, SARS-CoV-2, etc. And antibiotic drugs are routinely overused. That's in the news. That's not my opinion. That's in the literature. Antibiotic resistance is way up. There are just some natural things that people do. I'd like to share those with you. So do you want to go first with a few, and then I'll go with a few?
Yeah, I'll start, Dr. Mike. Yeah. So a Cochrane Review study said that most ear infections clear up on their own. Antibiotics are not needed. It says here that over 80% of acute middle ear infections resolve naturally. And that's not including, the people with the chronic and it ends up reoccurring. But most of them just clear up within 2 to 3 days. Yet they still give antibiotics and they're really over prescribed, driving a resistance, which is not really good. So, Mike, what do you got for your some solutions?
Yeah, it's just some overall simple common sense stuff that you hear people doing all the time. Keep yourself and your children hydrated, plenty of water, thins out mucus, prevents dehydration. Using a humidifier is common. I grew up in a house that burned wood primarily in the winter, and so you'd rub your feet on the carpet and get sparks, and it was dry. So we used a humidifier. It just keeps the nasal passages moist and can trap things and helps the eustachian tubes stay moist as well. You gotta quit smoking if you're smoking around a kid. You just have to somehow, some way, quit smoking around children and exposing them to secondhand smoke because it's a major, major issue. Breastfeeding is really critical for a lot of reasons, but it doesn't create as much mucus and fluid buildup in the eustachian tube, so they're draining easier. And then just the sucking motion with breastfeeding is just gives the child really, really, really good natural immunity from the mom and the probiotics from the mother's milk, which is really, really, really huge. I have some other home remedies that a lot of my clients have used over the years that I will share. But what else do you have, Dr. Gordy?
Well, the next one is nasal hygiene, such as saline nasal rinses or sprays. And this clears allergens, mucus, dust, and viruses. So it keeps the nasal lining moist and less inflamed. So it's really safe for daily use, both in children and adults. Also, it reduces the need for decongestants. The next thing I have is humidifiers in dry seasons. So dry air irritates nasal passage, much what you were alluding to. The next one is steam inhalation or warm mist loosens up mucus and improves drainage naturally. So it's great during the cold and flu season. And then, of course, managing allergies. That's another one. And there's so many things you can do naturally in that department. And even nose blowing technique. A lot of children are not told how to blow gently through one nostril at a time. They just don't know how to blow their nose. So the key is just one nostril at a time. Hard, forceful blowing can actually push mucus into the eustachian tubes and cause the very thing that you don't want, and that's infections.
So what several clients use garlic oil eardrops. If you want to learn how to make that, that's a really easy remedy to make. You can look that up online on do it yourself garlic oil eardrops. I think we even have some on the shelf and we used with our kids Mullen garlic ear oil. And so you put just a drop or two and we've only had one, I think we only had one full-fledged ear infection. I was my three kids' primary doctor, so my wife would bring them to me. And I didn't know how to culture bacteria or viral or anything like that. So I'm not sure if it was classified as a full-fledged ear infection I just know they're picking at their ear and they're uncomfortable and couldn't tell if it was teething or what it was. But we used to put garlic mullein oil in their ear and it would just take away the sting or the soreness right away. And then I would adjust them because there's nerves from between C1 and C2, upper cervical neurology. The nerve goes to a muscle that wraps around the eustachian tube. And so when there's subluxation, nerve interference, imbalance, mechanical obstruction, that muscle around the eustachian tube clamps down is a huge reason why the eustachian tubes aren't draining. And so a simple, easy correction, if there is a misalignment, really, 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 really helps. I would check my kids morning and night for a couple days, ear oil, nursing, good nutrition, boom, end of story. And it was super cool that we didn't need to bring him in for that. And then just a couple more probiotics. We used to give our kids liquid probiotics back in the day and or break open capsules and stuff. I don't know how much that got into them, but when they're nursing, they got a lot of probiotics through my wife. But probiotics were huge, huge, huge for us. And then vitamin D is really been shown to bolster immune system and is really, really needed in kids. So those were some really simple things, in my opinion. And I know it's easier for me to work on my own kids, but people bring in kids to see me. I just saw a 1-month-old this week and not for any symptoms, just to be checked up. But yeah, I love helping kids naturally, especially when the parents come and say, what can we do? We don't want to do antibiotics, or we've done antibiotics too much, or we don't want to do tubes. So I talk to them about diet for sure. Talk to them about what are they feeding, what are they, juices, chemicals, and eating out. What are you giving your kid? And just suggest maybe an oil and probiotics and balance out their spine and nervous system and brain. And bingo, their body can heal fast and heal properly, and then the parents can rest easier because they know their kid isn't going to have any hearing issues or any residual damage because it's so safe and effective.
Wow, thanks for sharing. That's great, Mike. And I think the other thing with the adjustment in the neck, besides what you had explained, there's also a neurological connection to the immune system. And there are so many studies that validate just that. So I think you can't ignore that. The next one I have here is topical home remedies, similar to what you had said. And there's everything from warm compressors to heated salt packs. And then you had mentioned kind of like the mixtures. That's another one as well that's really good, really effective against swimmer ear as well. Just use caution. The other one that I have is just reduce inflammation in your body. Avoid excess sugar, try to avoid processed foods, and just have a really sound nutritional program, especially when a child might be exhibiting signs and symptoms of ear infections. So,
I see a fair amount of Amish clients and kids, and they're famous for putting some breast milk in an ear to take the sting out as well. They swear by that, as do other moms have done that. So that's a home remedy that I hear about. Other natural antimicrobials, medicinal honey. I think you're a fan of Manuka honey, is that correct?
absolutely. Yep.
Yeah, so yeah, I don't know how early a kid can handle garlic and ginger. If you can sneak that into some food, I know that's really good to sneak into food, not the greatest for probably 1 year and under and all that. But if it's a 3 and 4 year old still getting ear infections or getting their first ear infection, see if they're up for putting some garlic in some stir-fry vegetables or something with ginger. Echinacea, my kids like echinacea tea as well. You can get echinacea liquid and drops, and golden seal, myrrh oil, thyme essential oil, oregano oil. You have to make sure they're safe for young kids. Clove extract, or some of the other ones. And what I have done in the past, personally, for my upper respiratory, and I know several patients are doing this, is nebulizing hydrogen peroxide is a really good way to clear up mucus. You mentioned early about nasal moisture and whether they're healthy, prudent nasal sprays. But I like to nebulize hydrogen peroxide and saline because you can just put a mask on and then breathe in and really get things draining. And it's a lot easier to have a kid blow their nose because it's kind of dripping already and they just want to just kind of push it out gently and easily, like you said.
I want to make a quick note on that point, Mike. I did that during I think a lot of people, you probably as well, did that, especially during COVID, because that was a big thing. But I just want to just err on the side of caution when using hydrogen peroxide. There's a certain mixture that you can get if you check it out on Mercola.com. If you have too much, that can actually do an opposite effect and really irritate your nasal canal. So I just wanted to let the audience know that if you're using hydrogen peroxide in such a technique, make sure you follow some really strict guidance with that. So
the ratio that I used, 0.3% food grade hydrogen peroxide, 0.3% for me, and saline solution. 16 parts of saline to 1 part of 0.3% food grade hydrogen peroxide. So it's not a lot. So I put that in a mason jar, and then you put 30, 40, 50 drops or whatever, maybe a half ounce or something in the nebulizer, depending on the size that you're using, and then nebulize it. So you're right, Dr. Gordy, it has to be a low. You don't just pour hydrogen peroxide and water and breathe stuff in. 0.3% is what I used, 16-to-1 ratio of saline. And some people, I never did, some people would put the essential oils in there and eucalyptus, etc., to add that in there, but I never did that. So
yeah, I had a colleague that used glutathione in her mixture as well. So you get pretty creative with it.
Yeah, and and I've read that Dr. Mercola, he used to do that weekly. Why? Just because to keep sinuses and nasal passages moist and healthy and breathe optimally and just keep everything. We wash our hands every day. Well, it's a simple way to kind of wash our sinuses and keep our insides really healthy, but not just sterile and over clean. So yeah, we gave some pretty interesting things, and when in doubt, talk to a pediatrician and a trained person because they check fevers, they check temperatures, they can look in ears. They see that all the time. Right? We aren't going to say 104-degree temperature and your kid's screaming. Just bring your kid to us in one adjustment and put a drop of oil in there and they're perfectly fine. I'm not saying that, but the average non-high fever ear infection, whether it's the first time or chronic, gosh, those kids are fun just to evaluate and take care of because I can help their body heal at an optimal rate and function properly by just doing what I'm trained to do as a chiropractor. And so it's really fun to see those kids respond naturally.
And I agree with you, Dr. Mike. Sometimes there's a limit. You need to get into the pediatrician. You're right, 104, they can hardly stand it. You can just see their body language, protecting their ears or itching or scratching. And those are sure signs that maybe there's something a little bit deeper, but yeah.
All right. Well, I like to end all of our podcasts by asking you what's your number one takeaway from this podcast. Maybe you can have a discussion about if you had ear infections growing up as a kid, you know how you were taken care of. Have you ever heard of chiropractors working with kids and or why would you bring a kid with an ear issue to a chiropractor? And so what's your number one action step? What are you going to do to take action based on what we talked about? What's your number one action step that you can do to optimize your immune system, to maybe prevent things from happening in you and or your family? With that, thanks for listening, and I'm glad we could share some really good information, Dr. Gordy.
Yeah, that was great, Mike. Thanks for sharing. Awesome podcast today. Hey, if you haven't already, please subscribe to our podcast, hit that subscription button, the notification button, and join us next week for another edition right here on the Health Angle Podcast. And until then, we'll see you.
Thank you for joining us on the Health Angle Podcast. Please subscribe to our channel and catch us for our next episode.